Okay, so what I'd like you to do is decide on what roles you're going to play in this scenario. I'll give you the information. You have some of the information there about what the scene is, and I'm going to give you the medical background.
Okay.
So that you'll have some understanding of the medical terms and medical illnesses. As I said, as was told to you before, we don't want you to be nervous about knowing the medicine. We want you to focus on the teamwork. So that's why we're providing all the medical information you'll need. So the roles that you need to decide on, you should have somebody who's going to play the role of team leader, somebody who's going to be taking the vital signs, someone who can call the provider for any questions and to give SBAR to fill them in on the information and to decide on recommendations. And then we need somebody to be an escort for the patient. Okay? So I'm going to take the patient out to another room, and the person who volunteered to be the patient, and I'll fill them in on their role while you're viewing the medical background. How's that sound?
Sounds good.
Okay?
Yeah.
So here you go. Any questions?
No, thanks.
Okay.
Great.
All right, guys. Well, I'm Abigail. I'm a nursing student.
I'm Laura. I'm a physician assistant student.
I'm Shoshana. I'm an OT student.
I'm Sarah. I'm a medical student.
Nice to meet you.
So I guess we should review the case.
Yeah. Looks like we have the patient coming from the rehab gym from occupational therapy, so activities of daily living training. I can be the patient escort and escort the patient from that training to the nurse's office.
Okay.
But it looks like the nurse isn't there.
So it seems like, so the facilitator said we need, what was it, a team leader, a phone caller, and someone to take vital signs, I think was the other one.
Okay.
So I guess if you want, I can be the team leader.
Okay, great.
Perfect. I can take the vital signs.
And I can hand off the call to the physician.
Okay, be the
provider.
phone caller. Okay,
Yes.
great. That's great.
Okay, Cassie. Thanks for volunteering to play the role of the patient.
You're welcome.
And what I want to do now is fill you in on exactly what that entails.
Okay.
So you're going to be a patient who's in your facility, you're in a long-term care facility, and you're going to be getting occupational therapy. After that session is over, someone's going to escort you to the nurse's office. You have an appointment in the nurse's office. And when you get there, the person who escorted you realizes there's a sign that says that the nurse is not there today. Well, you're very upset. Okay. You were counting on that appointment. You don't take change very well. And so you start getting anxious and breathing rapidly and complaining of your shortness of breath.
Okay.
Okay?
So we have some supplies, like an inhaler, stethoscope, but it says the inhaler is not going to work. We do have a paper bag too, so I guess that might come into play.
Okay, yeah, so we might want to use the paper bag. Yeah, it looks like, there are a lot of reasons for shortness of breath, obviously. So we'll want to ask a little bit about her history.
Yeah.
Asthma and COPD and stuff. Just ask that background, see what we find out, and then we can call the provider, maybe make a recommendation, but call the provider based on what we find out.
Okay.
So
All
that
right,
sound good?
sounds good.
Good.
Let's
All
do
right.
this.
Cassie, that was a good session. Do you feel okay?
Yes.
Your joints feel good and everything?
Yes, I feel fine.
Seems like we're making progress. That's good. Oh, it looks like the nurse, there's a note here, the nurse got called away to another facility. So
What?
isn't here. I know you had an appointment, but
Yes,
it looks...
I had an appointment.
it looks-
I made it myself.
Yeah, I know. But
don't
it just looked like
understand.
there may have been an emergency situation at another place.
Oh my God.
So I think
don't
we could probably
understand.
Is everything
reschedule.
okay?
She seems to be getting very upset. Do you
Yeah.
think you could get some
Yeah,
help?
we'll get some others.
I
Okay.
made an appointment. I don't understand this.
I understand that. But it's okay. We'll reschedule. The nurse just had to be off site
What's
at the moment.
happening?
Hi, I'm Shoshana. I'm the occupational therapy student. Cassie and I just came from an activities of daily living training. She was doing great. But we arrived here and the nurse got called to another facility, so there's no provider. She had an appointment, but it is upsetting her and she seems to be short of breath
I made
now.
this appointment
Yeah.
myself. She said she was going to be here.
I haven't been able to ask her anything, so maybe if you could assist me and we can do an assessment and then see whether we need to call the provider.
Sure. Yeah,
Okay.
so let's see what's going on.
I don't know what happened.
Hi,
Yeah.
Cassie. I'm Sarah. I'm the medical student. I'm going to take your vitals, okay?
Okay.
And I'm Abigail, I'm a nursing student.
And I'm Laura, I'm a physician
Oh,
assistant
too
student.
many people. Too many people.
Okay, it's all right, Cassie. We're making good progress. We're going to be okay.
I don't know.
Her vitals
I'm
are.
not feeling good.
So the blood pressure is 140 over 90.
Okay,
The pulse is 120.
okay.
I'm
So a
not
little,
feeling good.
so a
I'm
little
feeling
raised, I
lightheaded.
guess. So Cassie, has this happened to you before?
Yes, yes.
And how did it go when it happened before?
It lasted probably 20 minutes. I'm not feeling good. I'm starting
Okay.
to feel tingling in my lips
Okay.
and my fingers.
And fingers.
Do you have
Okay.
any history of asthma,
No,
Cassie?
Her
no,
lungs are
none.
clear.
None. I
You
don't
need
have
swelling in your
asthma.
legs?
No,
No
no,
pain? No
no,
swelling?
no.
What about her
I just feel
temperature?
lightheaded and my lips don't feel
Do you have
right.
any pain in your chest?
No, no. I feel tingling in my fingers.
What's her temperature?
Her temperature is 98.6.
Okay,
Her
normal.
pulse ox, you have that?
Yes.
99%.
Okay.
And her respiratory rate?
That's 30.
Oh,
All right, well, it seems like we have the vital signs, we know the situation, so Laura, do you want to call the physician to
Yes,
get
that
an
seems like a good
intervention?
idea.
Hi, doctor. I have a situation with a patient here who was receiving occupational therapy and she was doing activities of daily living session. And she came into the nurse's office, and when she found out the nurse was not here, she became very anxious and started breathing rapidly. We've attempted to calm her down, but that did not work. We've taken her vital signs. They
What were
are, her pulse rate's 120, her respiratory rate is 30, and her heart rate, or her blood pressure is 140 over 90. Those are all elevated. Her temperature is normal at 98.6, and
Okay.
her pulse ox is 99%.
Okay. She hasn't had any coughing or fever prior to this?
No. And we also listened to her lungs, and they are clear, and her upper airway is clear.
No swelling or edema?
And there's also no swelling in her legs.
Okay.
She also stated she didn't have any chest pain.
Okay. All right, so you're thinking that she has what wrong with her?
We're thinking she's having an anxiety attack,
Makes sense.
but we wanted to get your recommendations for further treatment.
Okay. Well, it sounds like she's been breathing rapidly, and that's part of the problem. Why don't you have her hold her breath for about a minute?
Okay, let me consult with the group. I'll be right back with you.
Okay.
The
I'll hold
doctor wants us to have her hold her breath for a minute. I'm concerned that's not the appropriate measure in this situation. I'm really uncomfortable with doing that, and I think it's a safety issue because I believe the patient's going to faint if we do
Yeah,
that.
I
Yeah.
agree. We have a mask. Why don't we ask if we can use
Okay.
that?
Yeah, make
try
that
one
more
more time.
time.
Yeah.
Doctor, I'm concerned that this is not the appropriate measure for this patient, and we are uncomfortable that the patient may faint, and that would be a safety issue. We do have a rebreather mask. Can we attempt to use that?
Okay, that makes sense. Why don't you go ahead and do that?
Okay, thank you. We should use the rebreather mask.
Okay, great.
Here, Cassie, just take some slow, deep breaths.
that should make you feel better, Cassie. Try to calm down and relax. Just breathe normally.